This is part 5 of our 8-part series that explores the ins and outs of identifying the best patient intake solution for your healthcare practice. Not all patient intake solutions are created equal, which is why it's important to know about the different program features, functionalities, and what to look out for. You have done your due diligence, and everyone is in agreement that you have found a digital engagement platform that checks all of you and your colleagues' boxes. Looming in the back of everyone's psyche is the dread of what it's going to take to implement and deploy what has been promised by the vendor. That dread is justified because it's often found during implementation that words like bidirectional integration and high-level customization mean entirely different things to the vendor and the customer. These buzzwords are used often and effectively to close deals. They are used quite liberally and, in most cases, not to the advantage of the customer. It's unfortunate that it is revealed in implementation after all the time was spent investigating and paper signed, making it more difficult to pivot to a solution that will meet your needs. As an example, imagine finding out that all of your patients will be getting pharmaceutical ads, or that you'll need a separate dashboard to push your patient's data into your EMR during implementation, or that not all of the data is going to the correct discrete field, or we can't do this assessment, or we don't handle HPI, etc. At that point, you have two choices: accept the quirky limitations as, this is better than what we had, or find a vendor that will be transparent and deliver the solution you want. In many cases, when their IT teams were able to successfully get an intake system up and running, it was often buggy or failed to integrate as promised. And you could forget about patient experience customization or branding. We hear this all the time from our satisfied clients that switched from another platform, many of whom were in the implementation process. They tell us that their project costs quickly spiraled out of control, and they began experiencing unanticipated system downtime and hard feedback from their colleagues, something no one wants or can afford. The implementation process became like forcing a square peg into a round hole. Again, in the end, after many headaches and much cost, these practices tell us they wish they discovered Yosi Health's patient intake solution sooner. We'd all like to leverage the capabilities of our existing systems to help us address the new business challenges and increase the size of our panels through the automation of the patient-consumer experience. The pandemic was the catalyst for major changes to the medical profession. Overnight, the entire healthcare field was in large part compelled to go remote, requiring digital engagement. For expediency, many practices employed a patchwork approach to upgrades, making a transition to digital solutions on an as-needed basis. It was like applying a wartime triage to a business model. And, as time wore on, it proved to be costly and inefficient. Why is Yosi Health's solution a superior approach? Chiefly because the Yosi patient intake platform used the latest technology associated with cloud-based platforms. That means we maintain the infrastructure for you. Our systems do the heavy lifting in the background. Your existing systems, the ones in your office, simply serve as an interface to connect your needs to our powerful online cloud-based solutions. By being cloud-based, Yosi is able to customize our services to meet your practice's needs, no matter what your current legacy systems are. Similarly, our back-end solution is platform agnostic and is available on all the mobile devices, tablets, and computers. And that's not all. Practices tell us that they love the fact that Yosi has partnered with the industry's leading EHR systems. Our fully genuinely integrated patient intake and registration platform automatically uploads and updates critical patient data in real time, freeing up your administrative staff to focus on patient management. If implementing a patient intake system is becoming nothing more than an IT nightmare, why don't you schedule a no-obligation, no-pressure, information-only call to explore how our cloud-based service can serve your practice. To find out more about our patient engagement platform and the entire suite of Yosi Health services, just give us a call. You'll wonder why you didn't do it sooner.